A growing number of people are scared to get treatment for serious illnesses or medical emergencies because they're afraid of catching the coronavirus. Hallie Pallier talks to an ER doctor who says they may want to think again.
Dr. Scott Self is the medical director of Blake Medical Center's emergency department. He says their arms are wide open.
We certainly want patients to come if they're concerned for stroke.
And quickly, as time is brain. But Dr. Self says lately, instead of going to the ER during a medical emergency, patients have been hesitant.
We have had some calls, and it is concerning because we have seen a decrease in volume, and specifically in the Northeast, we've seen a decrease in chest pain complaints, and we know heart attacks and strokes are still occurring.
This COVID fear seems to be a nationwide trend. A recent survey found 29% of American adults say they've delayed or avoided medical care due to concerns of getting COVID-19. And at the pandemic's peak, Ascension Health Systems says 48% fewer patients went to the ER.
We've put a lot of things in place to protect patients. So things like universal masking, that can be a patient or employee or a caregiver.
Dr. Self says they're also separating any patients who have COVID-19 symptoms from those who don't, like in the case of a stroke.
We're making sure that we're doing everything we can to safeguard patients.
So if you think you're having a stroke or other medical emergency, call an ambulance and don't let your fear cost you your life.
It's a safe place to be. You're definitely better served coming to the emergency department and not ignoring your symptoms.
In North Dakota, there are currently 32 patients in the hospital for COVID-19, and there are 455 in Minnesota. 199 of those in Minnesota are in the ICU. Still ahead here at noon, the latest delicious recipe from the Mr. Food Test Kitchen.